Wonderful. Well, first of all, I have to thank you, Domina, for chairing this session so that I could very quickly make sure that my slides were in order. Although I was very distracted in a positive way by the incredible talks that we've had this morning. So my other thanks goes to Sarah and to Bruno for basically introducing one part of my talk, which is the importance of better understanding mental health and the impact COVID has had on mental health, and to Baha, who puts the other side to the coin of my talk, which is individual and cultural differences. Now, the talk that I want to give today is on hunger for touch, providing a more nuanced view of what has been such an ever-present theme in the media over the last few months. Today, following on from the talk from the beautiful Katerina and Louise yesterday, with our current global study, I hope to provide you with another piece to the puzzle. And as I said, to build up a more nuanced perspective into what kind of touch we're missing, if at all, and what impact changes in touch behavior have had on our well-being. As we heard yesterday, social touch is just that. It is a channel for social exchange, for us to share our emotions, our moods, our desires, and it is what makes us feel connected to others. Later today, we will hear from Frances McGlone, our second keynote, and my collaborator on this project, more on why and how specifically effective touch has developed across evolution, but also across our lifespan. That is a preview, I think, to what he might tell us. I want to tell you a little about the rewarding value of touch. Now, interpersonal touch maintains social bonding on the one hand, because it is intrinsically rewarding. Activation of a special class of nerve fiber found in mine and your skin is activated preferentially by the kind of touch a parent uses to calm and comfort their child, reducing pain, relieving stress, and making us feel good. But the system also gets trained by our personal experiences and our preferences, as well as by the culture and context in which we live, and what a strange context we're living in now. So besides this intrinsic peripherally mediated reward, we also know that rewarding value and the experience of touch can change. A useful way of more generally thinking about our reward circuitry in our brain and in our body is how much more you crave something you can't have, and how good it is when you finally get it. Like that first cup of coffee this morning when it just couldn't boil fast enough. This is a learned association that drives a dopamine response in anticipation of that first dose of caffeine. And it's this rewarding value of touch that builds and maintains social bonds. And that is probably what we're seeing here in this film and in these pictures. This reward brain chemistry at work. Now, I had my own personal example of this. We had to be apart from my parents for a very long time to try and protect them. And my children struggled. They craved that hug with Omi and Dad. And in a world of extreme levels of stress and worry, what a lot of us are feeling that we are missing, and what we feel we really need is a really good hug. So in a nutshell, what I want to try and convince you of is that the effects we're seeing and personally feeling in the world today stem from a reward system that isn't necessarily getting what it needs, that adaptively we are looking for rewarding alternatives, but that despite elbow bumps and hug curtains, some, though not all of us, are feeling the effects of a hunger for touch. So this ongoing global study on effective touch in the COVID pandemic poses a couple of questions that can probably be best summarized here. How has our touch behavior changed? And that can go in both directions. What are the effects on well-being? And we'll be focusing in on loneliness today. Will we all feel these effects in the same way? And I'm going to really try and convince you that it's a much more nuanced overview than captured by these catchy headlines. And will these effects be long lasting? So the cohort data that I'm going to be talking about today are an Anglo-American cohort, part of a total of about 1,800 participants who've completed our study. It was a 12-minute online survey put together by our very wonderful Justin Sulik, who deserves most of the praise for any and all data that we get out of this. We started collecting early in May and continue to collect data. We've just finished the second time point and we'll have another 2 time points after that. More on this at the end, so hang in there. Our cohorts span 5 major language and cultural groups, but as I said, we're going to try and focus in on the Anglo-American data set and look for some mechanistic explanations as to the link between physical distancing, a lack of touch, and our mental well-being. So I think that I've hopefully convinced you about the motivation for this study. So for the rest of the talk, I will try and describe that mechanistic link between physical distancing and well-being, and specifically feelings of loneliness. I'll try to convince you with new evidence for a reward-based mechanism, detailing why and how a longing, a craving for touch results in feelings of loneliness. And to finish, I want to tell you about our next steps with some sneak peeks into our cross-cultural data. And again, I want to emphasize that so often with science communication, and this is a fault we all need to try and address, we need to look for a more nuanced description of our data. Now, for those of you lucky enough to have heard Katerina and Louise's talk yesterday, you will already have seen their data showing a link between the soothing effects of vicarious touch and loneliness. And although I think you'll see some similarities in our designs, I believe our approaches, though complementary, are somewhat different. And what I'm going to show you on this slide is an overview of what our cohort of participants completed in the first data collection. If you're interested to know about what we're doing in our follow-up, do get in touch. For this time point, though, our design was focused on trying to, first of all, quantify the degree of physical distancing. We then tried to extract some implicit and explicit measures of touch deprivation, as well as the subjective value, so how rewarding touch experiences are for those individuals, and for very specific types of touch from very specific types of individuals. And finally, how and whether or not people were coping without touch. And what these big orange arrows are hopefully showing is that in this stepwise fashion, we try to make a case for a mechanistic description of how the rewarding value of touch, as modulated by touch deprivation, results in adaptive coping behavior and finally an impact on mood and well-being. So to begin with, I'm going to try and go into each of those parts in a little more detail. So first, we wanted to assess and describe both the quantity and quality of touch our participants were experiencing as a function of the degree of physical distancing. In so doing, with the questions you see here, some in English and some in German, just to keep you interested, we could determine the size of their network, as well as who they could or could not touch. So specifically, we were asking whether the people they were in lockdown with were people they usually lived with, and if they would feel comfortable if that person put their arm around them. In so doing, we can differentiate between familiar and stranger touch, but also between familiar touch and what we might call so-called incidental touch, the touch of a stranger in a restaurant or at work or on a public transport. One very interesting result before we get to the results section is actually that only 15% of our cohort were actually living alone, with most people reporting to be in lockdown with family members. So I suppose a question we have to try and answer is whether and why we still miss touch even when we are not alone. And the answer I will be putting forward and hammering in is that I think it depends on getting the type of touch we crave but can't get. Longing is such sweet sorrow. But will this still be the case if social distancing becomes the new norm? So one very interesting thing is that unlike other pandemics, we were already living in a relatively touchless society. What will we be returning to after this pandemic? This is just to remind you why we are so keen on collecting longitudinal data in this study. The next link in the chain is to quantify touch deprivation. Specifically, we wanted to see if we could get at both implicit and explicit measures of our longing for touch. On the explicit side, we opted for the very good tool that is developed by Bessler and Croy and others in a very important paper in 2019. I would recommend you all to have a look at that. In it, you can create an index of received and desired touch for a host of different types of touch. Here you see 3 of them in these lovely cartoons drawn by my student Leonie Toan: a kiss, a hug, an arm around the shoulder, and a forearm stroke. But we also look at these types of touch from different types of people, different social categories. So again, we can differentiate between familiar touch that they could get because they were in lockdown with these family members, or by contrast, familiar touch that was out of reach. On the implicit side, and what I think is a major advantage of our study, is that we also included the so-called Navon Task, which assesses attentional mode. One in this task is either quicker at identifying the global letter made by the smaller array of little letters, or a local processing bias where one is faster at identifying the smaller letters that make up the whole. And then there's a way to make the task a little harder. Here we see little h's making up a big H. But in the incongruent, the harder version of this task, you see instead perhaps little letters in the form of S, and that they together make up a larger letter H. The assumption is that if resources are demanded, and there's evidence to show that in the case of pain, this is the case, but in ours, we suggest that the pain might be that of being deprived of touch. In these cases where resources are taken by this deprivation state, one will probably be slower than in the easier version of the task. But I should say from the outset that we hope to make more of this data. But for the moment, my apologies, for the moment, we can only really speak to what this task can also tell us about affective state. And I'll let you know about that when we get to the results section. With my coffee example from earlier, I told you that the reward circuitry in our brains can be trained to anticipate and need that first cup of coffee, or indeed that first hug in the morning or after a long day at work. There's nothing quite like that. We crave it because touch from others is and has been, since our mums and dads comforted us, a way to regulate mood and behavior. I should, however, remind you, and I think that this is something that was mentioned yesterday, is that the system has also been adaptive enough so that we can also respond to self-touch, as we saw with vicarious touch, as we saw yesterday. Seeing others being touched also activates this secretary. This is a sneaky improvement so that even when mum and dad or our partner are not around, we can still bring ourselves back to baseline. Capitalizing on these sneaky detours in our affective touch circuitry, we investigated the rewarding value of touch by asking our participants to imagine themselves being touched, or indeed touching themselves, by using an adaptive version of the embodied task, and that's what you're seeing on the left-hand side of your screen. Choosing either hot or cold colors, participants could say how soothing self-touch to those areas were, or how pleasant the touch of others would be if applied to those areas. Again, we differentiated with our prompts between individuals they were in lockdown with a stranger, with themselves, or indeed people that were close to them in heart but out of reach. In the second task, which you see on the right-hand side of your screen, is that we also asked participants to watch videos of vicarious CT-mediated touch. And what I mean here is that it's touch at that optimal velocity, that stroking that mum and dad used to calm us down as little ones, that activates those little nerve fibers I told you about earlier. We showed them the videos of touch to the face, a place we reserve primarily to touch ourselves, indeed to reduce stress. The arm, somewhere, a stroking of the arm, somewhere we might be touched by a stranger or indeed by ourselves, a shared space, if you will, and then a video of a stroke to the back, which is what we see here. somewhere hard for us to reach ourselves, and so evolutionary speaking can be seen as a primarily social space. Think of monkeys grooming one another, or indeed in humans, the all-important back massage. Interestingly, work by Walker and colleagues have shown that the actual or imagined touch to the back area, the social space, is consistently rated as more pleasant, with the suggestion that it is because it is more densely innervated by our beloved CT nerve fibers. So with our design, we can therefore make inferences as to the rewarding value of touch as a function of CT innervation and activation, in this case, by vicarious touch. The question we have to ask ourselves is, will the way we feel about our bodies and the way we think about touch change as a function of physical distancing and touch deprivation? Will it mean more in the short term, but less over time? Obviously, the central aim of our study was to quantify touch deprivation, but more importantly, to investigate its impact on behavior and mood. I've told you that it's part of a reward circuitry, but reward circuitry is there to drive us to do things. And so behavior is key. I hope that I've already hammered in the point that effective touch is fundamentally rewarding. And I have already hinted at the fact that if we don't get that dopamine fix through the touch we crave, we may turn to other rewarding behaviors. And another way of looking at it is that we are living in a world of heightened stress, concern for our health or that of our loved ones, financial worries, and maybe we need to find an alternative routes to self-regulate, to lower levels of cortisol. In our study, we therefore asked people to tell us how they were spending their time in isolation, with more or less questions for a list of rewarding activities. You see only a selection here. Some of these behaviors can be seen as more adaptive than others, and more sustainable should social distancing be protracted. For example, self-grooming behavior, like the extra baths we saw in Katerina and Louise's talk yesterday, might be a very good solution. Rubbing in the soap and the creams, making use of heightened multisensory experiences with nice smells and colors. But changes in eating behavior might be less of a long-term solution, although it too can create anticipatory dopamine responses and lower stress. And so we also asked people to tell us how they were feeling. Were they satisfied with their level of companionship? Another way of asking about loneliness. Were they sad or happy? Were they stressed or calm? Were they energetic or lethargic? Now, these questions were chosen because although broad brushstrokes, we think that especially across our longitudinal data collection, people might be more willing to answer the short and more direct assessment of mood and well-being. And together we try and look at the consequences of touch deprivation, both in terms of alternative, adaptive, and maybe maladaptive behaviors, and how that is making us feel. Lastly, before we get to our results, hang in there, guys, a very important part of this more nuanced description of our hunger for touch is that maybe how much we feel deprived of touch will depend on individual or cultural differences. Maybe we aren't getting as much touch as we would like, but maybe it means more or less to us depending on our individual and social norms and preferences. As such, we have a few covariates of interest that we've included in our models to get to grips with these differences, to more specifically test whether certain groups of individuals are more affected by physical distancing than others, maybe less sociable people, autistic individuals, the elderly, maybe men who are less likely to compensate with self-grooming behaviors. The stress of the situation may be harder for some to cope with than others, and maybe therefore they need to rely on touch to regulate more. We included the social touch questionnaire, which was in our case adapted to a slightly shorter form to also try and capture these individual preferences for touch, and therefore to better understand the variable meaning of touch and touch deprivation. We've made it to the results section. Now, intuitively, it may seem that self-isolation straightforwardly causes loneliness. However, it's probably key to highlight that the neurobiological mechanisms by which perceived loneliness, and we should remember that this is a subjective state, impacts health and well-being. these mechanisms are very poorly, if described at all. Interestingly, as early as 1961, people using cat models in this case showed that sensory deprivation can be used as a model of self-isolation, showing that cats behave in the same way that humans do when they are in self-isolation. Very recently, in April of this year, Robin Dunbar's group has shown the reverse, which is that people who are receiving physical contact have reduced feelings of loneliness. And they hint at reward circuitry by saying that the effects they observe might derive from evolutionary ancient bonding mechanisms, despite a cultural context that is relatively non-tactile. But I say hint because I think that we are still very much missing some more neurophysiological evidence of this link. Not that we can necessarily show physiological neural data in this time of COVID, but I think we're getting a step closer by really underpinning the value of touch with some of our models. And so the first result I'd like to share with you is a significant model of multivariate linear regression, where we use loneliness as the outcome, age, sex, isolating number, so that was that network size, the longing for touch questionnaire, both for familiar touch and the touch of a stranger, as well as that individual preference for touch, the social touch questionnaire. And what we can show is that younger people are lonelier, that older people are missing the touch of a stranger more. Women are missing the touch of a stranger more too. Perhaps those are their masseuse, or just they're more sensitive to the changes in touch behavior out in the wide world. We also know that those who have a higher number of isolation, so they're in a larger network of people in isolation, are also those that are less lonely. Those who have a higher longing for touch, familiar touch, are those who are also more lonely. Those in isolation alone versus those cohabiting with others but not family members miss hugs from family members. So we get a bit of insight into the very specific type of touch that people are missing as a function of who they're in isolation with. And so overall, we can say that loneliness seems to be predicted very significantly by a longing for touch as compared to those isolating with others. I will move on then to beyond these individual differences in how much we miss touch and the impact this has on loneliness. We can also see differences in the way we are coping with the effects of physical distancing. Specifically, to add more detail to my mechanistic account of touch and reward, what we investigated, and indeed what we found, is that as an adaptive species during COVID, as compared to before lockdown, we are turning to other rewarding behaviors. Specifically, we are eating more and we are self-grooming more. Importantly, this is also associated with our mood and well-being. Those who are less lonely are also grooming more. Those who are more lethargic are grooming less. So we see a significant change in self-grooming behavior is associated with positive effects on mood and well-being. Now, hopefully it goes without saying that self-grooming, like rubbing cream into your body, has an obvious and direct relation to the activation of those CT fibers that we've been talking about. Perhaps it's a bigger step to try and explain eating behavior, but hopefully I can convince you that that is not the case. Turning to food, which may also be perhaps a slightly less adaptive alternative to touch that we crave. Those who are more lethargic are eating more. Those who are more stressed are eating more. And perhaps curiously, from our Navon task, we see those individuals who show a more global bias in this task, which is a way to derive a measure of mood state. In this case, a global bias indicates a higher mood state. Those people who show this higher mood state are also those who are more likely to be eating more. Now, food is an interesting thing because food, on the one hand, from an individual level, is something we use to make ourselves feel better. That tub of Ben & Jerry's, for example. Food is also something that helps us to calm down. It has effects both on cortisol levels and makes us feel good. Interestingly, there is also data that shows that food offering has an effect on interpersonal mood regulation. So it's also something that can be socially used to regulate mood and behavior. But importantly, there's a bidirectional relationship between mental health and eating behaviors. It isn't always an indication of something we're doing adaptively to make us feel better. So one point I have to make is that with all this data, as at least to this point, we have not been able to establish causality. What is causing what? But what we could perhaps suggest is that those who are feeling less energized and stressed and are turning to food, and that for some, this behavior is helping them cope. One caveat is that we have not yet found any significant results for touch, that is using some of our measures of touch. But I say yet because we are working on it and hope to present more of this soon. Using another hierarchical linear regression, we tried to really put a focus on the rewarding value of touch, and using the scores for imagined pleasantness to that back area where we have that high density of innervation of these CT fibers, we entered age, sex, social touch questionnaire into the first stage of this model, and age and sex into the first stage of the model, and then added a host of others, our imagined vividness to the back, the social touch questionnaire, the self-soothing effect of touch, longing for touch from a stranger, and the longing for touch from a family member. And what we can show is that those people who have a higher individual preference for touch, as measured by that social touch questionnaire, are those who also imagined had a higher rewarding value from that rubbing back video. Similarly, those people who are more likely to be able to make a vivid image of it in their mind felt that this video watching was more pleasant for them. I'm going to tell you a bit about how that might change as a function of culture. I know I'm running out of time. So to very quickly tell you about our next steps, I want to finish by telling you that on the one hand, we have some very interesting cross-cultural data that is coming out. We collected data from 5 major cultural groups, and we're keen to explore differences in the way social and cultural norms are shaping our response to physical distancing and the effect this is having on our mental health and well-being. Some very preliminary results show, for example, differences between high and low contact cultures. In our cohort of Anglo-Americans compared to our Hispanic cohort, we find that Anglo-Americans have been isolating for a shorter time and with fewer people, that Hispanic participants are more satisfied generally with their level of companionship, they're feeling less lonely. Hispanic participants look like they imagine touch to be more pleasant, but we don't see that this is related to how vivid it is. So why is it that they are valuing it that more? We need to find this out, and we hope to come back to you with that soon. Interestingly, although Hispanic participants also seem to be longing for stranger touch than our Anglo-Americans, and do not seem to be longing for familiar touch, perhaps because they're getting it, these two cohorts do not differ in their social touch questionnaire, their individual preferences for touch. So is it a more cultural norm that is changing these, that isn't captured by the social touch questionnaire? Or are we still need to do more to understand the differences that we see between these two cultures? We also have some wonderful data from China, and I just want to point you to the poster on that, which should be online. And to tell you that we will be doing some longitudinal follow-ups. We finished the first 2 time points and look forward to seeing the changes that happen over these. It just leaves me to say thank you to a lot of different people. I've told you about Justin Sulik, who created the app and continues to help us collect the data. David Moore, who's done a lot of the analysis. Anton Varlamov for his wonderful videos. Adarsh Makdani, who helped us promote the study. Ana Tajadura Jimenez, who helped us with translation. Leonie Torn for the translation. Wen Han Sun for the translation. Francis McGlone for his unbelievable support and ideas. And to you for your attention and time. Thank you so much.
Fantastic, Merle. Thank you. Thank you so much for your talk. Very interesting data. And you sort of answered now at the end in the next steps 2 of my questions. One was on cultural differences. I think we have all asked this question, this past 2 days already, based on previous data. And the other one was whether you're planning to follow up on this research, and how do you see this changing? Yes, maybe mostly a year later, or after all the restrictions are lifted and we sort of go back to what we consider a normal life. Do you expect this to change?
Absolutely. I mean, I think that it'll be very culturally dependent and obviously COVID dependent. I think, as we heard yesterday, we're still very much in the middle of this. And the reason we've chosen the collection time points that we have is because it's anybody's guess what will be happening as we come to Christmas and our third data point collection. From time point 1 and time point 2, we can obviously compare during and after official lockdown. But if, say, and heaven forbid this is the case, we're in a second lockdown in December, it'll be very interesting to see if people are still feeling the same way or whether they're quicker to adapt. If, as I very much hope, and I think we all do, that we are starting to see this issue resolve, I am with you in trying to understand whether we will return to a normal and what kind of normal. My personal hope is, because I very much believe that we, at least in the West, we're experiencing a shift towards being a touchless society. I hope that what we will do, and what I think we should do with all our rewarding behaviors that can be both adaptive and maladaptive, is to focus on quality rather than quantity. Rather than eating the entire Ben & Jerry's or drinking 20 cups of coffee a day, have a moderate amount, but make it count. And as a multisensory perception researcher, I'm hoping that rather than letting that little CT fiber do all the work, think about your loved one. Use those vicarious systems to bring them to mind, to really want it, so that when you get that hug after a long wait, and I know some people are still waiting, Domna, that you will get an even bigger kick at the end. So my main hope is that whatever happens, that we all take this moment in time to focus on quality rather than quantity.
Thank you very much. And as always, one step ahead. You already answered my other question. My other question, it would be more like a comment. Give us something. What's your advice to us? But you already answered it, and thank you very much.
Thank you so much, Domna.
Quality, not quantity. Thank you. And I think, Mel, now it's time for our lunch break. We are going to in half an hour at 1 with more fascinating talks on well-being, mental health, social media, etc. around times. Thank you very much. See you soon.
Thank you so much, Domna, and see you all soon.